Good morning students, myself Dr. Vinaya Patil. I am working as an assistant professor in Vinaya Patil College of Physiotherapy. Today we are going to learn about Faradism under pressure. So first we'll look at this image. What are the minute details which we need to see in this image is pillow. Second thing is wire. This instead of wire you can say that the electrode which are placed inside the crepe bandage. So this is crepe bandage, and if you see it very carefully, you will understand that the crepe bandage is in method of lymphatic drainage. There are different techniques of crepe bandage method, like figure of 8, lymphatic drainage, and that we are using lymphatic drainage technique of crepe bandage. Second thing is the pillow is placed for elevation of the treatment part. It might be in lower limb, or if you are going to treat foot ankle joint also, you can place it on a pillow in a kind of elevated manner. Okay. And third thing is electrode. So one electrode, if you see very carefully, will be placed at here, forearm, and one at the bicep. Okay. Two electrodes will be placed. We can say that it is placed at a highest point. So whatever highest point is, you need to place over there. Here in bicep, and second thing is at the forearm. Now you have to first we'll see that what comes under electrical stimulation. So electrical stimulation of the muscle causes increased venous and lymphatic return, alters cell membrane permeability. This causes reduction of edema. So only of electrical stimulator we are seeing that when we apply the machine of electrical stimulator to any specific muscle, or we can say group of muscle, it will firstly what it will do, it will increase the venous and lymphatic return. Also it will alter the cell permeability. So what is the significance of cell permeability is, thing is that you just need to remember that that altering the cell permeability also increases, like whatever the permeable, it might be edema, it might be exchange of ions between the tissues or cell. This also alters. This rate of permeability is affected because of this machine. Especially it increases the cell permeability. That's why there is decrease in edema. That's why see it is written that this all effect combined causes reduction in edema. Now coming to very next point. The treatment is most effective if the current is applied by the method of which is termed as in Faradism under pressure. Now see, electrical stimulator itself alone is also effective in reducing edema because as it alters the cell permeability. But if it is just combined with the effect of Faradism under pressure, it gives more effect, means the reduction of edema is very in less time there is a reduction of edema. Now we will see what is Faradism under pressure is. Here the principle of Faradism under pressure is written. You just need to focus on this point. Okay. What you need to remember is how Faradism under pressure works. What is the principle of that? Okay. Just see, they have wrote that there is a combined effect of compression and elevation. Okay. What they have said, there is a combined effect of compression and elevation. How there is combined effect of compression and elevation is, first thing, compression is caused by what? Crepe bandage. Okay. Second thing, how is elevation of limb done? Anyone? Okay. The elevation is done with the help of pillow. Very good. Now, second thing is how there is a combined effect. We can say because of the electrical stimulator. What electrical stimulator or the electrode beneath the crepe bandage does? It does, especially it does anyone? Muscle contraction. And the rest time that we give, it causes muscle relaxation. So, in total, muscle contraction, muscle relaxation, compression and elevation total gives an pumping effect, and this combined effect gives pumping effect which causes an increase in venous and lymphatic drainage and which relieves edema in more rate as compared only with electrical stimulation. I hope you people understand. I'll explain the principle once again. Compression because of crepe bandage, second is elevation because of the pillow what is placed beneath, and the muscle contraction because of the electrodes of electrical stimulator placed beneath the crepe bandage, and followed by an effective relaxation which gives combined pumping effect which causes which increases lymphatic drainage and hence edema is relieved. Okay? We'll go line by line. In Faradic stimulation, voluntary control should be attained at the same time as that of electrical stimulator. Yes, this is very much important. What they have just suggested that, for example, if you see this image, they are saying that if you give a ball, okay, if you give a ball in hands, means if you give ball, for example, in hands and just to tell to press it, when this alternate contraction and relaxation is going on, means the pumping effect will going on, what will happen? It will increase the rate of lymphatic drainage in a more effective manner. The reduction of edema will take place. So they are saying voluntary contraction is also important while muscle contraction, relaxation and then pumping effect is going on. Okay. Now coming to the next one. Generally, electrical stimulator is started 5 weeks after the surgeries to prevent the wear of tendon. So whatever Faradic re-education or for whatever pathological reasoning or whatever therapeutic effect you are giving electrical stimulator for, you people just need to remember that it is given for after 5 weeks of any type of surgery. It is not given immediately. Why? Because thing is that the healing time is there. Right? You cannot just give the electrical stimulator immediately. Why like that? Because thing is that electrical stimulation causes contractions. Right? So when the healing time or healing phase is given for any treatment part, it should heal properly. Right? If you give electrical stimulation and the contraction takes place of that affected part, there is always risk of any kind of tendon tear or tissue or something. That's why for healing phase, you just need to give them a rest period of how much? 4 to 5 weeks. This is an ideal phase. After 5th week only, you can give electrical stimulation for any kind of surgery. Now, second thing is electrical stimulation increases muscle strength, which is always greater than voluntary contraction. Why do you think that there will be increase in muscle strength? Yes, anyone. For example, if you take dumbbells in your hand, weighted dumbbells, okay, and you just keep on doing for flexion extension for longer time or repetitive manner daily for certain days, okay, and what will happen? Do you think that your biceps will get strengthened? Yes, your biceps will get strengthened. Why it will get strengthened? Because of alternate contraction and relaxation, or you can say that it is causing a kind of exercise of that specific muscle. In the same manner, electrical stimulator, it also does the same thing, muscle contraction and relaxation. That's why eventually, same as that of what I gave example of dumbbells, same like that only. Both, while in dumbbells also you are doing repetitive action of muscle contraction and relaxation. Same like that, the electrical stimulation, one is voluntarily and one is So same, what will happen is that there will be strengthening of muscle. Improved venous and lymphatic drainage is brought about by pumping action of alternate muscle contraction and relaxation. I have told you previously only, when there is pumping action because of this Faradism under pressure, there is improved venous and lymphatic drainage. Now coming to next one, during electrical stimulation, the patient is able to see the whole procedure. It elevates the fear from the patient towards the current treatment. Why like this? You think that patient confidence you will gain means the patient is able to see what kind of procedure is going on with him, means whatever, how you place the electrode, how you just apply the grape bandage and all. And patient will feel also that there is not kind of that danger or risk current what we are applying for, and it is also giving a therapeutic effect like relieving of edema and all. So patient can visually see whatever treatment we have given, and we can also gain the confidence of the patient towards our treatment and also a positive approach towards the treatment. Now coming to the next one. In Faraday stimulation, stimulation of the muscle at the motor point produces group muscle contraction. Means if the stimulation of muscle is around or nearer to the motor point, then there is a group muscle contraction. Why do you think that they have said here? Very important point is that here very important point what you need to remember is motor point. Why a motor point plays a very crucial role is that because you can say that there is greater blood supply. Okay, and also the it has if you go nearer towards the motor point, there will be group muscle contraction more than single muscle contraction. Okay. Now coming to the next point, stimulation of peripheral nerve at point where they become superficial produce contraction only in isolated muscle. Okay, I repeat this point again. Here there are three important words which you need to remember. Is stimulation of peripheral nerve at points where they become superficial. So where you need to just stimulate the peripheral nerve, where they have written the word, where they have said where it becomes more superficial. Stimulation of what? Stimulation of peripheral nerve where they become superficial. What it does is that it produces contraction in what manner? In isolated manner. Okay, so these three words are very much important in that. Now coming to second thing. As the general rule, the passive electrode selected should be of larger size as compared to active electrode. So passive electrode should be larger and the active electrode should be very small. Okay, you just need to remember this, that larger electrode should be passive one and the active electrode should be the smaller one. Now coming to next, this is the rule. Okay, just by heart this rule, that the surge and contraction with this two together form what it forms. It is a combination which gives pumping effect. Now then the surge or the off time is known as the rest period, and where there is stimulation parts, that is the contraction period. And what should be greater? And general rule, the surge interval rest period should be greater. So rest period should be greater and contraction period should be lower. Okay. So can any one of you tell me that why rest period should be greater and contraction period should be smaller? The main significance is that the rest period should be always greater, so to cause an effective contraction for the next thing. So for example, if I just get my my student and tell that person to run for like 1 or 2 minutes, okay? And just make him run for half hour together, and I just provide him rest for 1-2 seconds and just tell to run again. Is that possible? Is it possible that the student will run for longer period for the next time? No, because why? The rest period is not given in a very efficient manner. Then what we should do, that's why the contraction period should be less and rest period should be, I'll give you the ratio, it should be 3 times as that of surge period. Why? So that, for example, if you give the same student, if you make him run, for example, then you tell the student to rest for 15-20 minutes, and if you tell to run again, then in effective manner the student will be able to run. In the same manner, after contraction, you give an enough rest period as that of 3 times that of contraction period. It will rest properly, and next contraction will be in an effective manner. So, contraction followed by effective relaxation period is very much important. Okay? Now, the treatment is either continue for desired duration or stop prematurely if early fatigue occurs. So, the thing is that, as I said, as that of contraction, rest period should be 3 times as that of. We give mostly like 20 minutes to half an hour. Faradism under pressure, this is the time. But thing is, if the patient feels fatigue or if the patient tells any discomfort towards our treatment, then we can just stop with the treatment. Okay. Now what you need to see is in this is that drape bandage. Here the pressure. Here what you need to see is 3 plus. Here that will be 2 plus, and here that will be 1 plus. Okay. The pressure. The pressure here. So here most pressure will be here. Okay. So I have written 3 plus. The highest amount of pressure of the drape bandage will be applied at the foot region. Okay. Then at the ankle, and then over the knees or thigh. Okay. Why do you think that the pressure is highest at the ankle or at the foot region around toes and all? Can anyone answer me? No? Okay. Listen. What I am telling. The thing is, for example, first thing, it will be in a part of elevation. Okay. Elevation will be there. And thing is, what is effective in this? Then there will be a stage, okay, and here there will be foot, okay, place. Now, the foot will be there. Here the pressure is 3 plus, here there is 2 plus, and here there is 1 plus. So, when the edema will start decreasing, what will happen? The thing is, the edema will start flowing towards the ankle, towards the knee or towards the nodes, what we can say. While it is flowing, for example, if they feel that pressure is not enough or something like that, they will start to revert back. The edema will start to revert back towards the foot. So that's the elevation is there, so that the edema will drain. And even when the pressure is high, do you think if the pressure is high towards the foot, do you think that the edema will revert back towards the foot? No, it is not possible. Why? Because it is elevated also, and then the pressure is high. So the edema will drain from highest point to the lower. But from lower to highest point, the edema cannot revert back. So this pressure system is very much important. That the highest pressure, I repeat again, the highest pressure should be more at the foot, then at this one ankle region, and then towards the knee or the thigh. So least will be. So what you remember is that least pressure will be at towards the knee or towards the thigh, and most highest will be towards the foot. So in drape bandage, there are very vast techniques for application of drape bandage. Now, what you need to remember, like anyone who who can tell me what are the methods of applying trade bandages, like figure of A, right, lymphatic technique. And here lymphatic technique is used for effective drainage of lymph. Now, what do you think? Only drainage of edema is only the mechanism of this? Anyone? There are different. Okay. Forget the Faradism under pressure. We'll move a bit that of physiological effects. Can anyone tell me what are the physiological effects? Physiological effects of Faraday or something like that. First thing what will happen is like there will be contraction and relaxation. Yes. Now can you people tell me, like contraction and relaxation is there. What all thing comes with contraction and relaxation? We'll move a bit to first slide, means you will understand. So first thing is, with muscle contraction and relaxation, what is going to happen? Okay, increase in venous and lymphatic return. Okay, fine. Then there will be altered cell permeability, and this all will eventually cause reduction in edema. Okay. So first thing is, also there will be increase. Now coming to basic thing, with increase in lymphatic and venous return, do you think that there will be increase in blood supply also, increase in metabolic rate also, O2 demand will increase? Yes. All these factors are also going to change. Also, there is vasodilatation and all. All these are the effects coming with this, right? So first thing is what? Increase in blood supply. How there will be increase in blood supply is vasodilatation. What happens in vasodilatation is there is increase in width of blood vessels. Okay. Now coming to next one. What will happen when there is increase in venous and lymphatic drainage? Will cause decrease in edema and also alternate muscle contraction and relaxation. See, muscle is not going to relax by its own. You people need to provide a surge or rest period or off time, whatever you call. Okay, that will give it a surge period, and again when stimulus will pass, it will again contract. Okay, and when you apply it with elevation and crepe bandage, this thing it is called as Faradism under pressure. If there is no crepe bandage, there is no elevation, and if you apply the electrical stimulation directly, then it is specific, like it might be your Faraday or galvanic treatment. And when you combine it with other things, so what is the principle of this? This is pumping effect. Okay, pump. This is the main. What is that? This is the main principle. Okay. Now you just need to remember this. Now coming to next thing is compression and elevation. So what causes compression is anyone? That is crepe bandage. Okay. What causes elevation is anyone? What causes pillow? And what causes contraction is whatever. What causes causes elevation is pillow. What causes contraction and relaxation is this electrode. What is placed to that, and what causes compression is this crepe bandage, and contraction and relaxation is because of electrode, and what causes elevation is that of pillow. And what is the main principle of Faradism under pressure is the pumping effect of that muscle, which gives alternate contraction and relaxation, compression and elevation. Together it gives a pumping effect. Okay. And also, what are the other physiological effects? Is increase in blood supply, increase in lymphatic venous and lymphatic drainage. Second thing is that is only vasodilatation, increase in metabolic rate. Also, nutrition supply towards that affected part is increased. Then O2 demand also increases of that affected part where the Faraday current is applied. Okay. So here again you can see pumping action. because of alternate muscle contraction and relaxation. So what is more important thing is voluntary contractions. I said, anyone, if you have forgot the thing, at the same time as that of electrical stimulation. Okay. What I told you that you should place a ball in the hands, and even if for lower limb, if you have applied it over the foot and or calf and all, what you should do is that there should be plantar flexion. You should tell the patient to plantar flex and dorsiflex, so that there will be, that is also kind of voluntary action which will give the pumping effect in a more effective manner. Now, started 5 weeks after the surgery to prevent it. And what you need to remember is this, that you cannot perform any kind of surgeries in 5 weeks. Any kind of you cannot perform any kind of treatment or stimulation before 5 weeks. You have to just wait for 5 weeks. Why is it 5 weeks for? I'm repeating just for a kind of revision and very important point, like principle and all. I want you to learn it here itself. Can you tell me why there is a 5 week of rest period? Yes, so that the healing would not get affected and it will heal in a proper manner. Okay. So what does it mean that it will heal in a proper manner? Means why? Because if you apply electrical stimulation, there will be muscle contraction or relaxation. Why? If the muscle is contracted or any kind of muscle movement is there, there might be injury for any kind of tissue, cell or tendon. So the healing will get disturbed. So to avoid this, because of movement, what will happen? That the healing, whatever the heal layer might be, it might get disturbed. That's why muscle contraction is totally prohibited. Other good effects are there, like there is increase in muscle, there is increase in blood supply, nutrition supply, O2 demand and all. But it doesn't mean, but because of muscle contraction and relaxation, what will happen? The healing thing will get disturbed, and that's why it is not preferred. Now, yes, I have told this. Yes. Anyone can tell me what is the rest period? Yes, the rest period is as that of 3 times. The surge period is as that of 3 times as contraction period. Why? Because if there is effective muscle contraction, then effective muscle relaxation, then only the person will able to perform the next contraction very, very effectively. Okay. Now coming to the next point. Okay. This I have told it in a like the highest supply should be over the foot, then towards the calf around, and then the lead should be at the thigh or the knee region. Okay. So why highest? Only simple thing what I have explained is that the whatever the edema or whatever the fluid that is reverting back, means that what is coming towards the lymph node to get drained out, what is happening to that? It should not revert back, right? Means even if, but if it goes into fatigue and all, there are the chances that the fluid or whatever the edema will be, that will try to retain back towards at its same area. That's why this pressure is maintained, so that it will effectively keep coming down, do not revert back. This is lymphatic drainage technique. For crepe bandage. Why only this method is used and why not other? Can anyone explain me this? Yes? Why not figure of 8 and all? Why only this kind of lymphatic technique only for crepe bandage? See, what you know is here, if you see, here are lines. Okay, like this. Okay. Why like this only? Yes, anyone? this pressure is not maintained, for sure the lymph will not get drained effectively. It will get drained. It's not like that, but only 30 to 40%. But if you apply the crepe bandage in the form of lymphatic drainage technique, it will give 70 to 80% of drainage of of that edema. Okay. Now coming back to this one. When it is flowing and if the fatigue occurs, to avoid fatigue, so see, you can see that everything here is interlinked. It's not like that, because see, the first thing is what you need to remember while applying crepe bandages, that the pressure should be highest at the foot or the towards fingers, and then while coming distally, you just need to lessen the pressure. Why? To avoid the revert back of edema. Then what are the chances of edema returning back? There are high chances. That's why what you should take care of when it will occur, when there is fatigue of muscle. Okay, and then to avoid fatigue of muscle, what we do? We give a very important rest period. Okay, rest period is given. So to avoid fatigue. And how much time is the rest period? It is 3 times as that of contraction. This is very important. That the rest period is 3 times as that of contraction period. Why? Anyone can answer me that? Because after one contraction, there should be effective next contraction, and to perform the effective next contraction, there should be enough rest period given. Okay. Then how much it should be? It should be 3 times as that of that. Okay. Now, what is the general rule? Can anyone answer me? That the passive electrode should be larger as that of active electrode. Can anyone tell me what is the? So can you tell me where should be the passive electrode and active electrode? Do you think it should be at the biceps, or it should be at the highest point of forearm or around the wrist, where you have put the active electrode? Where you should put the active electrode? Do you think that the active electrode should be at a point where there is most pressure? Yes? Yes or no? Obviously. Why? Because there will be contraction and it is going to drain. Okay? Fine. Now, second thing is stimulation of peripheral. I have told that you just need to remember 3 important points, that is stimulation of peripheral nerve at points where they become superficial. So, where you will stimulate the peripheral nerve? Yes, what do you think? Stimulation peripheral nerve is where? At the superficial. So, a point, the stimulation of peripheral nerve is only at a point where it becomes superficial. And what will happen when you stimulate this point? You can just contract that isolated muscle. It's not group of muscle, but when you want to contract a single muscle, then this is going to happen. Now, what should be the treatment time? What is the duration? What I have told you? Yes, what is the duration? Anyone? Yes, the duration. First thing is patient convenience and patient fatigue is very much important. Okay. Second thing is you have to just note or ask the patient for his convenience. The ideal time is like 20 to 30 minutes where you can apply Faradism under pressure. But with patient convenience and conversation, you just need to decide. Okay. Now you have understood where the pressure needs to be maintained. This is the method what we have gone through for the lymphatic drainage crepe bandage technique, which you need to apply while application. Now this is Faraday footbath method and this is Faradism under tension. Why Faraday footbath method is used? So that there will be even there will be even what evenly electromagnetic field will be spread. Okay, so where will be the placement of electron? One will be at the hill, or and the second one will be at the car, just to interconnect, right? And because of that car, there will be a kind of pumping effect, and effectively there will be a pumping effect called, and it will give the desired therapeutic effect. And what is Faradism under tension? Is that same. That was Faradism under pressure. The pressure word was because of the crepe bandage, like which gives pressure. What about Faradism under pressure? Even if you apply the Faradism under tension, in a kind of which manner? In a kind of tension. Tension can be provided. Tension is a kind of weight. Okay. So tension is provided in a kind of weight. You can also take it as an and you can also place the patient position can be also given in a kind of anti-gravity, not or gravity assisted, not. It shouldn't be gravity assisted. Why like that? So that it's by its own body part only the movement will, or its own body part will provide the weight. Okay, which will eventually lead to tension. And Faradism under tension is especially Faradism under pressure under tension is applied especially for group of muscle. It cannot be given for a single muscle. Okay, I hope everyone is clear with this. Now coming to next point, this was Faradism under tension, where own body weight was given as a source for group of muscle only. Once again I repeat, it cannot be given for one single muscle. Okay. Now coming to before point, this is Faradism under foot bath, where water is placed. This is, if you see the images, this is a kind of lymphatic technique for crepe bandage. Okay. This is here they have given how much to pressure maintain at the level of crepe bandage. So highest at the foot, then around the calf or ankle, and most least is at the knee or thigh. And coming to this point, this is patient positioning, where they have told the principles of Faradism under pressure, which is first thing is effective contraction, relaxation, compression and elevation. Okay, so compression is by crepe bandage, elevation is because of pillow, muscle contraction is because of the electrodes, like a stimulator electrode which are placed beneath the crepe bandage, and lastly it is relaxation. Why relaxation? So that the next muscle contraction will be very much effective. Now, why do you think that the next effective muscle contraction is important? Because it is a kind of a cycle. You have to just maintain that pumping effect. So, what pumping effect will cause? Pumping effect will cause reduction in edema. By what means? By means of venous and increase in venous and lymphatic drainage. First thing what you need to remember in all this is the physiological effects. So what are the physiological effects? Once again, increase in blood supply. It's because of vasodilatation. Why it is because of vasodilatation? What will happen? In vasodilatation, there will be increase in blood vessel width. Okay. Now increase in blood vessel width. Now what will happen? Increase in blood supply there. With blood, because of increase in blood supply, there will be increase in metabolic rate also. Now what leads to means whatever the metabolic rate is, because of that there will be increase, or nutrition supply will also increase. Then nutrition supply will increase, which will eventually lead to demand in oxygen. Oxygen demand will increase. Okay, this physiological effects in mind, you have to just go with the principle of, lastly, before finishing the lecture, important thing, once again I repeat, is the principle of Faradism under pressure. It is a combined effect of compression and elevation with compression and effective relaxation, which totally gives an pumping effect, which helps to increase in venous return. Okay, thank you.